Hello, I'm Carsten Flohr from London. I'm Chair in Dermatology at St John's Institute of Dermatology at King's College London. I am a pediatric dermatologist and have a particular interest in atopic dermatitis, and that's what I talked about at this year's EADV. I had a talk where I was able to give an overview of the most exciting developments in the last year, and that ranged from preclinical disease, so us thinking more about what can we actually detect in the skin even before atopic dermatitis develops. It's a bit like an iceberg that's coming out of the water. The disease is actually already present before you can see it with your naked eye. We are aware that there's a reduction in natural moisturizing factor, for instance, which is an important part of the skin barrier structure. If you have less NMF, you've got less mortar between your bricks, and that can be detected as early as 2 weeks of age. We're aware that the microbiome is not normal in children who develop eczema, and their lipid structure is also not normal. And it's interesting that we can now look at this in early life to then develop preventative methods. One of the most promising areas is to use something very simple, and that's emollients in babies across the board, shown by a colleague from the US who did a randomized controlled trial that I talked about, 1,200 children being either randomized to an intensive emollient application, intervention, or standard care. And in that study, we found there's a significant reduction in atopic dermatitis as the children became older, and so that's obviously very exciting. I also talked about the impact on growth in atopic dermatitis. There seems to be a reduced growth in those who have the disease compared to healthy controls, and we need to do a little bit more work to understand what exactly is going on there. And I'm aware that some pharmaceutical companies have got very detailed information through some of their profiling on bone growth enzymes that will allow us to be able to see that. But if that is true, that those with atopic dermatitis as children don't grow as well, we obviously again need to do something from a preventative point of view. Therapeutically, I talked about the novel systemics, the special OX40 ligand antagonists. So that's a systemic therapy that's injectable, that's coming through into clinical practice over the next few years, as well as a novel topical treatment. So nice to see a new cream coming through, having not had anything like that for many years. And there's a trial using a cream called tapinarof, which is an AHR receptor antagonist, which is not only tested in adults, but in the same study in children. Really nice to see down to age 2 with a significant improvement up to about 40% compared to 20% in the placebo group compared to the intervention group when it comes to the investigator global assessment reduction. I also wanted to tell you about an international study that I'm leading called the Global Atopic Dermatitis Atlas. It's a study that's running under the auspices of the International League of Dermatological Societies. It's a bit like the United Nations for dermatology. We have realized over the years that we don't know much about the burden of the disease in middle and low income countries, whereas a lot of research has historically been done in places like Europe, North America, quite a lot of data from China as well, but big holes in Africa, South America, and other East Asian countries. So we need to make a difference. How are we doing that? We are running an evidence synthesis project. So it's a living systematic review, if you like, where we are bringing in all the data that's regularly being published to put that on our website, accessible to the world, and informing patients, physicians, and policymakers, including the World Health Organization. You're running an international consensus exercise around the methodology, how this data should be collected in the field, because we've realized there's so much diversity in the way people have done studies, which makes it very difficult to compare results from one study with another. And then we want to understand with mechanistic work what happens at the level of the skin barrier. So for instance, how microbes, bacteria, and fungi interact with the skin immune system in atopic dermatitis in relation to environmental factors like air pollution or sun exposure. Important factors, there can be other protective, thinking about UV light as immunosuppressive and can be protective against atopic dermatitis, whereas of course pollution, so I'm talking about fine particle exposure, is an important risk factor for atopic dermatitis, not just being exposed as a young child, but also as a pregnant mother. If you live in a highly polluted area, there's a significantly higher risk of atopic dermatitis developing. So that's just GADA, as we call it, Global Atopic Dermatitis Atlas in a nutshell. If you'd like to understand more about the study, go to our website, www.atopicdermatitisatlas.org.